A thank you for a task that not so long ago would have seemed unimaginable. A centre better known for holding worthy conferences, ready to take as many as 5,000 COVID-19 patients. The beds and equipment lined up, ready and waiting.
Today there are over 9,000 positive coronavirus patients in hospitals across England, and we know that number is only going to increase. That's why what you see here is a mass mobilisation taking place right across the country, but also at these new Nightingale hospitals.
There's lots of people upstairs working right now that are from mostly our London hospitals, mostly our intensive care staff, whether they're nurses, doctors, ODPs, physios, they're all coming together, and there's 400 people right now upstairs being trained.
And they need more, but staffing has become a critical issue in itself. 1 in 4 nurses and doctors are now either sick or self-isolating. The GMB union said today that more than 4,000 ambulance workers across just 8 trusts are off work. Testing, 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 as the World Health Organization likes to put it, is being increased now for staff. Trusts told to allocate up to 15% of their daily capacity for England's NHS workers in quarantined households. Since mid-March, Wales has already tested 1,000 staff. Look familiar? They've even set up testing stations like these, again, having taken them down after the government said only patients with pneumonia in hospitals and care home clusters should be swabbed. So just over 8,000 were carried out in England yesterday on just under 5,000 people. Not the 10,000 ministers had claimed at the weekend, and it's a long way from Germany, where they test 500,000 a week. The hope by those in government too that the controversy over personal protection equipment, or PPE, might die down was in vain. Plans to update the advice to hospitals, GPs and community workers have been delayed. They were meant to be signed off on Friday. This doctor demonstrated the apron he was given to wear in an urgent treatment centre. He took in his own face shield and overalls, but was told to leave if he didn't feel safe.
The worries that particles from the virus that could spread to you on you, the best place to be protected requires neck above, around this area. And the apron, when you put it on, it's open around chest line above.
The Trust told us it was not the standard approved by Public Health England and that it was important that staff comply. Yet we have been contacted by NHS staff from across the country who are making or buying their own protection equipment. A graph released today at the Downing Street press conference shows admissions have gone up at about the same rate for the past few days.
That shows that it's going up not in an increasing amount, but going up in a constant amount, which may suggest that we're already beginning to see some effects through.
But with the doors due to open here on Wednesday, the warning is that the worst is yet to come.
Well, Victoria joins me now. There's a lot of figures flying about today. How can you make sense of them for us?
It's become deeply confusing. I mean, you have to say it's very impressive that they've been able to open this hospital, the Nightingale Hospital, so quickly. But within that, there remain these concerns, as I said in my VT, over PPE, the personal protection equipment, and over testing. So we're not seeing the widespread testing that, as I mentioned, we saw in Germany. And what we're not seeing are, across the array of death rates. Now, this is because they haven't been looking at what's been happening in the community. So if somebody dies at home or in a care home, and we have felt that this hasn't given us a proper picture. But from tomorrow, the ONS for England and Wales will start publishing rates from the community once weekly, where a death certificate lists COVID-19, and Scotland and Northern Ireland will be doing something similar. So we should start to get a better picture of what's really happening out there. But it does remain the problem that we don't have this testing in the community, so you can get a proper balance of how many people have got COVID-19 compared with how many people are dying. That still feels some way down the line.
Victoria, thank you very much.
Social distancing is starting to make a difference, according to the government's chief scientific advisor, Sir Patrick Vallance. Published data showing that transport use across the country has plummeted to a quarter of normal levels over the last 10 days. He said that the number of hospital admissions was going up, but at a steady pace, which suggested that the clampdown was already having some effect. Our political editor, Gary Gibbon, is in Westminster. Gary.
Well, as you say, the Chief Scientific Advisor clearly saying there in the press conference today that he now thinks enough has been done on two parts of government policy to maybe mitigate what could have been an even worse number of deaths in this country. On the one hand, the clampdown, which he produced some graphs showing had really taken an enormous hit on transport, the number of people who are getting too close to each other and all the rest of it. And on the other, the government increasing the number of intensive care unit beds around the country. The combined effect of these two things, he said, is, and he used the word should, he now thinks we should undershoot the intensive care unit provision, so not overwhelm, as it had been feared, the intensive care unit provision that is in the country. As I say, partly because the beds are being boosted, but partly, he said, because of this clampdown, which of course is only a week old today. Standing next to him in that press conference, the Foreign Secretary, Dominic Raab, he was focusing on the £75 million that the government says it's going to put into bringing back Britons who are abroad, who are travelling for work or for pleasure all over the world and haven't managed to make it back. That money is going to go into charter flights. Individuals may have to contribute to fares, but it is really not easy to get some of these people back. If you look online at what various ambassadors and high commissioners are saying in their messages online, they're saying, if you're in the wrong part of a country which has had an extraordinary clampdown on travel and you're not near an airport, it is going to be extremely difficult for you to get cross-country to a plane, even if a plane is laid on. Dominic Raab, of course, is the man who is meant to deputise for the Prime Minister if he is indisposed. But the Prime Minister is still doing his job, even though he's suffering from the disease himself. And we discovered that the Prime Minister's chief aide, Dominic Cummings, has also had to go home. He's showing symptoms of COVID-19, a sign of just how difficult it is perhaps to maintain the government's own distancing guidelines in the cramped and old-fashioned surroundings of 10 Downing Street.
Gary Gibbon in Westminster. Well, joining us now via the internet is Professor Hugh Montgomery, who is Professor of Intensive Care Medicine at University College London. Professor Montgomery, the chief, scientific advisor, Patrick Vallance, today suggested there was cause for optimism in today's figures. Do you share that view?
I trust Patrick completely, actually. He's a completely principled and honest man, and so is Chris, so witty. So I share his view if he's expressed it, because it will be right. The fact that things aren't moving up exponentially as they were has to be a good sign. But of course, it doesn't mean that we're not still facing massive pressures, because we're already facing a lot of pressure and the numbers of patients are still mounting. And that's going to cause us further trouble.
Now, you were very worried last week about intensive care beds. Are you more encouraged, particularly with the opening of the Nightingale Hospital?
Well, I have to say, pay tribute to my colleagues who are trying to set that up, because these are very difficult times. And it's worth perhaps offering a slightly more nuanced approach to this, because I think that's sometimes helpful. We've had, all of us, I think, across the country to expand up the capacity to deliver critical care. And that's required a dramatic change in the sort of work that we do and the way we practice it. So what we might now look at as an intensive care bed is not quite the same thing that we would have viewed a couple of weeks ago. So, for instance, we've had to train different staff. So across trusts in Great Britain, with the bedside support nursing care, the delivering direct care, are often not critical care trained nurses, but have been rapidly inducted and are supported by a critical care nurse. Where normally that bed would perhaps have one critical care nurse to that bed, we now have one critical care nurse looking after 3 or perhaps even 6 beds. And we've had to use a change in equipment. So we would have had perhaps, let's call it the Rolls-Royce of ventilators, the things that help you to breathe, which are subtle and allow quite sophisticated management of lungs. And we've now had to move, in many cases, to the use of anaesthetic machines, which are very much more simple devices for blowing air in and out. So whilst we're saying we haven't run out of bed spaces, the nature of the work in those beds has now changed dramatically. And actually, at this point, I must point out the extraordinary work of our nursing staff. They are absolutely taking the brunt of this and having to perform in a way they never have before, and they are remarkable.
How close do you think we are to the eye of the storm? At one point it was sort of April the 3rd, then people said April the 13th. But what are we talking about now?
Well, I don't know the data. The last data I heard was we were aiming for April 13th or 14th. If Patrick's suggesting that we're now off an exponential curve, I guess it's possible that either we will still peak on the 13th or so of April, but that the peak might be lower. In which case, thank you to the British public who have socially distanced, because if they are helping with that, flattening that curve will have made a lot of difference. And I think, in fact, in many ways, that's the most important thing. I'm less worried about when...
Can I ask you specifically... Sorry to interrupt, but can I ask you specifically about the sophistication of this equipment that is being used in the hospitals? I mean, are there enough people now able to operate it?
There are enough people, but we're having to change our working practices. So, for instance, the first step, if one goes to a hospital with this disease, if active management is undertaken, will be simple oxygen to breathe in at higher and higher levels. The next step is to wear a hood or a tight-fitting mask that applies constant pressure inside the lungs to support the lungs. And then the next step is to go onto a breathing machine that does the work for you. Now, until 2 or 3 weeks ago, the use of these tight-fitting hoods and masks and the high concentrations of oxygen and so forth would definitely have taken place in an intensive care bed. But now that is happening in many trusts on general wards, but with support of anaesthetic colleagues. So we're just having to deliver in a different way. So are we able to provide the staff? At the moment, yes, we are. But it's by doing things in a way that we weren't doing them a few weeks ago.
And briefly, does the Nightingale Hospital, with its enormous number of beds, does it kind of mean that we are sort of within the bounds of control in terms of being able to provide beds?
I think it's going to make a lot of difference. And again, my credit, the credit goes to people trying to set this up. It's not a situation one would like to be in. It's being built because conventional beds such as we have and conventional ventilators are likely to be exhausted. So we're having to expand capacity in a different way. This won't be a standard intensive care unit by any manner of means at all in terms of staffing or equipment. But that isn't in any way a criticism, because we are where we are. If we are going to exhaust the capacity we have conventionally in hospitals, there is only one solution, and that is try to create something else that might offer us the support that is otherwise lacking. It won't be the same as a standard intensive care of 3 weeks ago, but it will be capable of offering life support in some way, shape or form.
Professor Hugh Montgomery, thank you very much indeed for joining us. Thank you.
Now, a group of MPs has written to the government urging clarity on which employees should and shouldn't keep on going to work, saying that non-essential workers were being put at risk by some employers. But factory bosses are warning that they're in danger of being vilified for keeping operations running. Meanwhile, the coronavirus is causing more airlines to scale back operations or ask for a government bailout. Our business and global trade correspondent Paul McNamara reports.
If a nation's on lockdown, we're not flying anywhere either. And today, EasyJet brought its entire operation to a halt. It had already cancelled most services, in recent weeks just running rescue flights to repatriate Britons stranded abroad. For now, they've stopped too. All 344 of EasyJet's planes across Europe are stacked up and going nowhere. And the airline have told us they don't expect that to change until May at the earliest. So that's nearly 2 months making no money whatsoever. At the moment though, the airline says there is no plan to ask the government for a bailout. EasyJet haven't ruled out taking up one of the loans the government has offered all businesses though. That's a bit rich, some critics have said, for a business that managed to pay shareholders £174 million in dividends just a few weeks ago.
Scotland's airline Loganair is coming home.
This is an industry in ill health, though, because of coronavirus. Regional airline Loganair saying today, without government help, they simply won't survive. The nation's empty arteries tell a tale of an entire economy grinding to a halt. There are still some pockets of industry ploughing on, causing many to ask, just what is essential?
These are the main inner components of the magnet in an MRI machine.
In fact, 50% of the world's MRIs have parts in them from this factory. But the boss here says mixed messaging from government has left staff wondering whether or not they should be turning up to work.
There are going to be some people at home who look at this and think, come on, this is just a business here. That's what they're really worried about is their bottom line.
I find it quite offensive that there's people talking about profiteering. That is not what's going on here at all. We can't function unless our material suppliers are there providing the material and the fasteners and the fixtures and the welding consumables and all the things that we need.
More than 100 MPs have written to the government urging them to be stricter on who can and can't work. The Labour Mayor of Manchester says he's had 1,000 emails from workers forced to continue despite fears for their health.
Fundamentally then, are you happy for any non-essential businesses to carry on working in this environment?
Not particularly, because I think stay at home should mean stay at home. And if you don't have to be out, then you shouldn't.
But where do you draw a line? Because manufacturers we've spoken to say they're essential. Their suppliers would argue that they are not essential, but they are if manufacturers are to carry on doing what they do.
I think that's the issue, isn't it? Everyone will argue that they're essential for this reason or that reason. And we could all have that debate and it could go on endlessly. The government has said that non-essential work can continue. So the point is, surely, that if it is to continue, making sure that people are safe as they go about that work, that has got to be the issue.
Lots of manufacturing is still running, though, not essential. Do you think they should be shutting the doors?
Again, you need to think through all the various nuances. It's often one of the smallest pieces in the jigsaw that actually spoils the picture and you can't quite finish the job. The significance of that really does need thinking through.
In the era of coronavirus, the word essential occupies a grey space. Many workers say they fear for their well-being. Many businesses argue, be too heavy-handed and the light of industry could go out for good.